Good afternoon, all. I, Dr. Kazishwadul Alam, moderator of today's webinar, welcome you all on today's AO Alliance webinar. The theme of today's webinar is biomechanics and biology of fracture stability. There will be two topics presented by two separate presenters. First, there will be the biomechanics and biology of absolute stability presented by Assistant Professor Dr. Farid Uddin Ahmed. And the second topic is biology and biomechanics of relative stability to be presented by Assistant Professor Dr. Sharia Rahman. In our expert panel of expertise, today we have Professor Mohammad Shahidul sir, ex-head of the Department of Dhaka Medical College Hospital, Professor Shafiqul Islam sir, head of the Department of Rangpur Medical College Orthopedics Department, and Associate Professor Mohammad Khurshid Alam sir, head of the Arthroscopy and Arthroplasty Unit of Dhaka Medical College Hospital. So without any delay, I am asking Dr. Fariduddin Ahmed to start his lecture on biomechanics and biology of absolute stability. Dr. Fariduddin Ahmed.
Assalamu alaikum and good evening to everybody. I welcome everybody to AO Alliance Bangladesh chapter webinar series. Now, I'll talk a little about the biomechanics and biology of absolute stability. Am I audible?
Yes,
Yes, you
are audible.
Okay. So, learning objective of this lecture is define absolute stability. Describe how absolute stability affects the bone healing. Define the indications for the absolute stability and explain the techniques to achieve the absolute stability. So bone fracture, intact cortical bone is very much strong enough and stiff, but it can deform only 2% before it breaks. Thus, bone breaks under very little deformation. And when a mechanical force is applied to intact bone that exceeds the structural integrity, usually fracture happens. So what happens when a fracture gets in the bone? We know when the fracture is left alone, a fracture bone will heal on its own. It's a normal phenomenon. But without providing some sorts of stability, our deformity may occur, resulting in shortening, angulation, and rotation. And sometimes there may be loss of functions of the fractured limb. So, target of the treatment of the physician or orthopedic surgeon is help the normal process of healing to occur properly and functional. And thus the aim of fracture treatment is to obtain and maintain the reduction, restore the stability for healing, and definitely decrease the symptom like pain that will cause the promote healing, and finally return to the normal function. And the degree of stability will determine the type of bone healing. So there are many factors that affect the bone healing. And out of those, number one, type of fracture, whether the fracture is simple or complex. And number two, the type of reduction, whether fracture is reduced anatomically or it is reduced functionally. Number three, type of stability achieved, whether it is fixed or treated with absolute or relative stability. And finally, the type of implant chosen. The implant, they may provide the absolute or relative stability. So a lot of cascades of event happens when a fracture occurs. When there is acute fracture, there is hematoma formation in the fracture site. And afterwards, there is microvascular ingrowth and formation of the granulation tissues. And finally, cell differentiate into bone. In this stage, method of stability or methods of healing depends on type of stability provided for the fracture healing. If the absolute stability is provided, the bone will heal by direct bone healing, that means primary bone healing. And if the relative stability is provided, the indirect bone healing occurs with formation of the granulation tissues.
Dr. Fariduddin Ahmed, can you please stop for a bit? I think there is a technical problem and you have been muted. So just give us some minutes.
Okay, now
Okay,
can
now,
you hear?
now it's better. Yes, now we can hear.
Yeah.
Just
So
roll back 1 or 2 slides back and then start again. Yes,
Yeah.
from here. Yes, it was over after that.
Okay, sure. So I like to say there are a lot of event happens when there is a fracture. First of all there is a hematoma formation at the fracture site. And following hematoma, there is microvascular ingrowth. And there is formation of the granulation tissue. And there is cell differentiation to bone. At this point, method of healing depends on the type of stability. So if absolute stability is provided, the bone heals with the direct bone healing process. And if relative stability is provided, bone usually heal with indirect bone healing with formation of callus. Now we can define the absolute stability as the means there is no micromotion at the fracture site under normal physiological load. And this requires anatomical reduction and stable fixation. And the best method to produce this absolute stability is interfragmentary compression. And absolute stability usually leads to direct bone healing. So what happens when absolute stability is provided? We can see this photograph. This is an osteotomy site which is fixed, which is reduced anatomically, and